Welcome and join me in a little study sesh. I am studying infection control precautions in asepsis. I was doing some homework and I went over the wound care lecture and stuff like that, and that exhausted me, so I am getting up. I am just walking whatever, my little vicinity and studying. Okay, so what's a way that vaccines work and how do they play a role in fighting things off? So, a vaccine it's a form of the virus, but in different strains. So, they tell you to get the flu vaccine to get certain strains. They're different. All of them are. You can still get the flu. People don't think they can. You can still get the flu. It just minimizes your symptoms. So the minimization of your symptoms are from you getting the virus put into your body, so it can just figure out how to act. So, healthcare-associated infections impact patient outcomes due to them suffering from the illness, as well as having longer hospital stays, and overall it does increase costs because with it being a hospital-acquired infection, the hospital is now responsible for all of the payments now. Once it is said to be a hospital-acquired infection, it's the hospital's responsibility to pay. So let's say your patient breaks a hip, okay? They break their hip from a fall in the hospital. So now all the surgery and everything after that for their care is taken over by the hospital. That's the thing. That's why we try to minimize risk of falling and introducing bacteria when inserting catheters, IVs, drawing blood, everything of that sort. Okay, so what could be a nursing diagnosis that would apply to patients with infections or at risk of infections? Well, one could be that your patient's immunocompromised, obviously, and their bodies aren't able to fight off any infections. So it makes them more at risk due to having all the viruses and just not being able to fight off anything, or what am I trying to say here? So a patient on a ventilator is more at risk of getting infections from people that come in and out of the room due to a tube down their esophagus and all that. That has a lot to do with a lot of infections and for people to overcome them. Describe how the healthcare team collaborates in infection prevention and control. So the precautions and regulations that are set in the hospital are meant to follow and understand in order to prevent patients from getting sepsis or any type of infection from you or anything that's hospital acquired. Discuss the evidence-based impact of hand hygiene on decreasing hospital-acquired infections. So, for a C. diff, For a C. diff patient, you wouldn't just use hand sanitizer, alcohol-based, because that doesn't kill it. It's Clostridium difficile, so you have more problems, and if you're on antibiotics, you can get sicker, and you're more susceptible of getting C. diff as well. But hand washing is the main key, the main takeaway. Hand washing is key. I already talked about the implications to the facility when a client develops a hospital-acquired infection. The hospital has to take over anything that happens after it is clarified a HAI. Can't speak. And then I already explained when to wash hands and not using hand sanitizer. But you use hand sanitizer anytime you're entering and anytime you're exiting the room, or in between dressing changes or anything of that sort. You don't just put gloves back on. You have to put hand sanitizer on to kill the germs that you just introduced back onto your hands from taking off your gloves. Okay. Explain the difference between medical and surgical asepsis. This is one that I don't quite know all the way yet. So medical asepsis, it reduces number of pathogens referred to as clean techniques used in administration like medications, enemas, tube feedings, and daily hygiene. And then hand washing is the number one key. And then surgical asepsis eliminates all pathogens referred to as sterile technique used in dressing changes, catheterizations, surgical procedures. Okay, so medical procedures are referred to as clean techniques. You're using them as whenever you're giving medications, enemas, hand washing, tube feedings, daily hygiene. Okay. Then surgical asepsis eliminates all the pathogens by using the sterile technique. So anytime you're inserting a catheter, you have to have sterile technique. Anytime you are doing surgery, sterile technique. Anytime. And dressing changes, like I said. So the role in maintaining a sterile field as a nurse would be, first off, you can't have your hands down here. They have to be above your waist. If you got gloves on, they have to be above your waist. You can't reach over the sterile field. You can't have anything out of the 1-inch border as well. Let's see. You can't turn your back either. To dispose of things, you're holding it higher and disposing and dropping. You don't want to go like this. That you're not sterile. Absolutely not sterile if you do that. Or hands down below the waist. And you want to have your working space at waist level as well, because you don't want anything out of the sterile field or the sterile space while trying to maintain that sterile field. Explain the difference between sterilization and disinfecting. So sterilization, you're killing everything, all the pathogens, all the bacteria, all organisms. But for just disinfecting, you're killing everything except spores. Like you're not killing everything. That's what it is. Discuss standard precautions and when to use. So standard precautions we're going to use anytime that we are introducing our, like, all the time we're using them. Standard precautions are just like washing your hands and just following the regulations. Anything after that is added on. So airborne. So for airborne, if they have TB or COVID, you have to have like N95s, gown, gloves, mask, yeah, and goggles too, I believe.